Hello and welcome. My name is Chris from christopherhall.com and welcome to this short presentation about movement and low back pain rehab and prevention. Now, it's becoming more and more prominent that movement is a part of the cure, the prevention, the rehabilitation, the management of lower back pain. And what we're going to do, we're going to explore what you guys can do with regards to movement and how you can go about it, because it's not just about going out and moving, it's about going out and moving properly in the right way at the right intensity for the right amount of time. So as we move through this presentation, we're going to start answering some of those questions and you'll be able to understand what you need to do to be able to lower your risk of experiencing low back pain in the future. Okay, so let's get straight into it. So the first thing to understand is that we've got a neuromuscular system. And as you can see on the bottom bullet point is the nervous system controls our movement. Now, how does the nervous system control our movement? Well, through the brain and the spinal cord. And it uses sensation, analysis and response to do it. So we sense things in our environment with our sensory nerves, our ears, eyes, nose, mouth, touch, taste, so on and so forth. It then travels, or the sensation then travels along those sensory nerves into the spinal cord, potentially up into the brain. We then analyze those senses, and then our brain gives its motor response. So for instance, if there was a box on the floor and we wanted or we had to pick it up, we would sense that there is a box on the floor, we would see it with our eyes. We would then maybe go down and find out how heavy it is. So we are sensing using our tactile touch and our visual eyes and senses to find out and analyze what that box is like. So we're sensing it and we're then starting to analyze that sensory input, as it were. Once we've done our analysis on that, we are then going to use our nervous system to pick that box up using the motor nerves. Now what happens is in our perceptions we perceive the box is big and it's heavy. Okay, so what we need to do is we need to bend down, and I'll explain how to bend down on the next slide, and then we go about picking it up. And that's what we're going to look at on the next slide is the motor nerve and the response part of it. So we've looked at the sense, we've analysed it, and we're now going to go into our motor nerves, and we're then going to use our motor responses. Okay. So what we have here is our conscious and our unconscious control. So this is kind of how we move. We either move unconsciously or consciously. Now, majority of the time, will move unconsciously. They won't really be too aware of maybe how they're moving. In fact, I say majority of people. I say all of people do that. It just depends on what the quality of that unconscious movement is. If we've put in good quality movement and we move unconsciously, we're going to experience less low back pain than if we move incorrectly unconsciously. But what we have to do is we then have to go about changing that unconscious movement from an incorrect to a correct. So in the brain and the spinal cord, movements are stored as motor programs. Now what that kind of means is if you can think of an MP3 player with an album on it, and the album is called Movement, and all the tracks on that album are picking up a box from the floor, getting out of the car, getting into the car, pushing a door open, pulling a door open, lifting a weight, walking upstairs. You've got all those different tracks, and there aren't just 12 tracks, there's hundreds and hundreds of tracks that are basically our movement. Now, as a young child, we learn our movement through trial and error. So you may see a baby who lies on the floor. They then start to sort of roll over. Once they finish rolling over, they sit up. Once they finish sitting up, they practice sort of getting up and crawling. Once they've practiced crawling, they get up onto their feet. Once they've practiced getting up onto their feet, they practice sort of standing without holding on to anything. Then they practice walking, then they practice running, and in between all that, they then get into lifting and carrying and things like that. Now, majority of children, they'll tend to move correctly, so they'll use correct squat technique. And if we just look at the two pictures on the right hand side, you can see the top picture and you can see the bottom picture. Now the top picture is a picture of a guy called Kelly Starrett, who is sort of movement and mobility specialist, let's say, and you can see him in that posture there. Now that would be described as a correct squatting posture. Okay, you can see his feet are roughly shoulder width apart, knees outside of the toes, so he's got external rotation at the hip. His body is upright, his head is in a what would be known as kind of a neutral position. Obviously he's looking to the side a bit there, but he's in a very relaxed position in that sort of squatted position. He's in a way he's quite relaxed and he could sit there for a very long time. If we look at the one below, this is slightly different. Now, if it was enlarged, what you'd be able to see is that this guy, well, you can see is that his back's rounded. So that's sort of the first incorrect part. Now, I'm not going to say it's horrendous in the way he is, but I'm just using it as an example to sort of work against what would be sort of say a more correct and a less correct, let's say. So first of all, we've got a rounded back. Second of all, we've got the feet that are slightly falling in, so you can just see the outside of his left foot there is raising off the floor, and it's slightly falling in, which is going to keep his or bring his knee inwards, which is going to internally rotate the hip, which is going to unstabilize the hip. So what this is showing is that we have incorrect and correct movement. Now all these incorrect and correct movements are stored in the brain. So what we have to do is we have to recode these programs and turn them from incorrect to correct. How they become incorrect could either be through an injury or just repetitive movement. So the easiest example I can use for injury is we twist an ankle. If we twist an ankle, we get an inflammation. If we get an inflammation, the body wants to protect that joint, so it creates a limp. Once we've created a limp, we get a compensation in the way we walk. That compensation can overwork and overuse and misuse certain muscles, which can create a pain in later years without us really knowing about it, because our brain unconsciously changes how we move. But what it doesn't do, once the injury is healed, it doesn't always go back to its original setting. There will be some movement flaw held within that motor program. So an injury can cause us to change the way we move. Also, repetition. If we just move incorrectly consistently, our brain learns it and it becomes the way we move. So if we can learn how to move incorrectly, we can learn how to move correctly. And that's what we're going to look at in the next slide. Okay. So recoding patterns and programs. Now it's this recoding of the pattern and the program, or pattern/program, that is going to help reduce pressure on the joints of the body and get the bigger, stronger, more powerful joints working as they need to be as the primary sort of movers. So for instance, the hip, the ankle and the shoulder, those are sort of the primary movement joints, because they have the most movement at them. The hip and the shoulder with the most movement, the ankle with the, let's say, the second most movement, and then we've got the knee and the elbow, which has only got sort of just, you know, flexion and extension. It can bend and it can straighten. So we're looking at how the body moves. Now, as I've said, practice makes perfect is an incorrect statement, because we can learn something wrong and we can create basically a fundamentally bad movement. That's incorrect. So what we need to do is we need to recode these movements and use correct practice to make perfect. Okay, so first of all, in the recoding process, first of all, we have to go through some sort of assessment. Now you can do that yourself, you can get another professional to do it, whatever it is, but we need to go through some degree of assessment to find out not only how our joints are moving individually, but also our movements. So for instance, we would lie down on the floor or lie down on a bench, and they would test how our neck, how our shoulder, how our hips, how our knees, how our ankles, how our shoulder, thoracic spine, how they all move individually. What we would also do is look at how the movement as a whole, so we would look at squatting, we would look at deadlifting, we would look at lifting, we would look at carrying, we would look at pushing, we would look at pulling. So how are all these movements looking? What is the quality of these movements? Are you experiencing pain in certain movements? So we would go through some degree of assessment. That helps us build a picture of what your body is doing. Okay, so it gives us an idea of what your motor programs are currently, and it gives us an idea of what motor programs are potentially creating, causing, or contributing to certain low back pain experiences. Once we've built that picture of your current motor programs, we can then start using movement, stretching, nerve flossing, self-myofascial release. You can use chiropractic, certain degrees of physio, osteopathy, all these different types of therapies. We can start using them to change the way that we move. But the most important one is movement, because we can go to yoga and we can make our joints really flexible. But if we don't know how to squat, then our brain will never build that program. It will learn to have a very flexible hip, but it won't necessarily learn how to use that hip within movement, if you can follow what I'm saying. So we have to use movement, stretching, nerve flossing, self-myofascial release, and various other different therapies to help us be able to do the movement and learn how to do the movement. The final one is diaphragmatic breathing. Now, what diaphragmatic breathing does, that is sort of the gauge as to which allows our brain to learn. If we say we go down into a full squat, so we look at the correct posture, or we just look at a squat, and we go down into a squat, and we find it very hard to breathe. Our brain isn't going to learn as well as if we are in that position and we are relaxed, because our brain doesn't learn very well under stress, because if it's under stress, it goes through the fight or flight, which is impulse or reaction or instinct. So it just uses very primitive survival techniques, and it will literally just get itself out of that situation. So it won't necessarily learn new and better motor programs and patterns. So as we start moving, as we start stretching, as we start massaging and using self-myofascial release, we need to be able to be diaphragmatically breathing during and sort of in between sets in our recovery. Because we're not going to be using a lot of load, we can use diaphragmatic breathing during. So we could go down into a squat, hold it for 3 cycles of breath, and then we could come back up. So again, we're learning this whole process of how to move. Okay, so first of all, go through some sort of assessment. Second of all, learn movement, use stretching, nerve flossing, self-myofascial release, which is using foam rollers and things like that. If you want to go and see chiropractors, osteopaths, physios, massage therapists, use that as well. But most importantly, use movement, because again, like I said, our body can become very flexible, but it doesn't necessarily know how to move. And then finally, use diaphragmatic breathing as your gauge to be able to learn, because we are relaxed, we aren't using our stress response, which is fight or flight, which our brain then isn't going to learn. Okay, well, I hope this has been helpful. If you want to come and learn more, then come to the website. I've got 12-week programs on there which will use these 3 components to be able to help you learn the correct movement. Okay, many thanks. My name's Chris from christopherhole.com. I will speak to you in another presentation.